Welcome to the Associate Certification course for Pharmaceutical Sales Data. This is Lesson 1, the overview and the purpose of the course. So what you will learn, we're going to go over a lot of things in this course, but the main topics we're going to discuss are the many different types of pharmaceutical sales data, also called pharma sales data. The terms life sciences encompass pharmaceutical and other industries like biotech and healthcare, so just be aware that sometimes those terms are used interchangeably. We're going to go over how pharma sales data is collected and compiled, what the data means. It's one thing to have a whole bunch of data. It's something else to use business intelligence, BI, and understand how to take that data and answer questions and make informed decisions specifically for your task or your role within your organization. No matter what your role in a pharmaceutical or healthcare organization, understanding pharma sales data is extremely important. It's going to help you do your job better, and whatever your goals are in your profession, in your life, understanding this data is going to help you attain those goals. Why is pharma sales data different from other industries? The main reason is to start with is pharmaceutical industry is highly regulated, and there are many rules and best practices that apply. Now, sales associates use this sales data all the time, but so does a lot of other people within the organizations. The main thing we want to go over right now with this is that the tracking of sales, how it is different in the pharmaceutical sales industry. When you make a sale in any other industry, you know if you made the sale or not because you, quote, closed the deal. So if you're selling copiers or paper, when you make the sale, the customer pays you, you deliver the product, and that's it. It's done. But it's very different with pharmaceutical sales because you are not actually selling directly to the patient. You have a brand, a product that you are promoting to a healthcare provider, a doctor, and you're hoping that that doctor then writes a prescription for your specific brand for their patients, and then their patients will go to the pharmacy and get that prescription filled. So you really don't know whether you closed the deal or not because you take the word of the doctor that, yes, I'll write your product, I may write your product, but you don't know until you get that data at the end of the week or month or whenever your sales period closes so you can see what's going on. Support staff will be looking at projected data versus actual data. This is just to say that all data is not collected. When these vendors go out and collect pharmaceutical sales data from pharmacies, they don't collect 100%. They collect a certain percent, 80 to 90%, and they project the rest of it. So it's an algorithm that's put together by these vendors, and we'll go over this later on. Where does pharma sales data come from? So it comes from a variety of sources. You'll have your internal company data. Then you'll have external data that's collected by your company, and it's put together and compiled. And lastly, you'll have data that your company, your pharma company, will purchase from third-party vendors who specialize in pharmaceutical sales data or specific segments of pharmaceutical sales data, and you'll pull all that together. As we mentioned in the previous slide, vendors buy sales data from pharmacies, and they use a projection methodology to approximate the actual number of prescriptions written. So again, they don't collect 100% of the data. They come close, but not 100% of the data. So therefore, they use an algorithm to project out the actual number of scripts written per territory, per doctor, etc. The companies, your pharmaceutical companies, will compile data from all these different sources, and then they'll generate deliverables, which are like dashboards, reports for your field personnel and also your home office personnel. And again, deliverables include dashboards, reports, alerts, things like that. The best deliverables are actionable, which means if you're getting a report or a dashboard, you want to be able to take that and do something with it. You don't just want a backward-looking report on how you've been doing. You want to get a deliverable that tells you if you take this action, you will increase your sales. There's many terms and acronyms that are specific to the pharmaceutical industry, and we'll go over all of them later on. It's a very, very kind of an insider industry. Once you get an idea of what the terms are, you'll know the insider speak, but you can go to a meeting as a young sales associate or a young person, a young professional just joining an organization, And you'll, for the first few weeks, be lost because you won't know what they're talking about with all the insider terms. So after you take this course, you're going to understand all those insider terms. And even if you've been a professional in the pharma industry for years and years, you may not be, you may not know what's the targeting and alignment terms or the incentive terms. So you'll learn all these terms within the course. Know the law, legal concerns. Just want to go over this as well. We're going to talk about this more later on, but deep pockets theory. So the pharmaceutical industry is sued often for a variety of reasons, and obviously they're going to go after them because they do have a lot of money, and therefore they're going to want to sue them. So deep pockets theory means that if a sales associate makes a mistake or somebody in a company makes a mistake, they'll go after the company itself because they have deeper pockets. The pharma industry is under constant oversight from local, state, federal governments, as well as private groups. We'll go over the Healthcare Insurance Portability and Accountability Act, HIPAA, which basically concerns patient privacy and de-identification of patients, mixing sales data and patient data. And then lastly, the perception of the industry by the public. The pharma industry is a great industry. I mean, if you think about the tens of thousands of lives they save with their products and brands, it's great. I'm not here to promote them, but the perception is through the media that they are just overcharged for their services, overcharged for their products, which is really not the case. And we're not going to get into this a whole bunch, but when it costs you hundreds of millions of dollars to bring a product to market and you only have a certain number of years on your patent to recoup those costs, you have to charge a specific price for the product to get your cost back. Otherwise, you're going to lose money on every launch brand you have. And that's why product costs appear to be high early on, but as soon as the patent runs out, generics launch and they knock off a market share of the branded product, and that's why the prices come down at that point. So we'll go over all this in detail in later lessons. The certification course is going to be comprised of 15 plus different chapters. We're going to have 10 questions at the end of most of the chapters. There's going to be a 100-question final exam at the end of the course. You have to receive an 80% or above on the final test to actually get the certification. You can take the final exam as many times as you want. Same with the quizzes. You can take them as many times as you want. We're going to continue to add more and more content to all those who have enrolled in the course, and that additional content will be free of charge to help you along your way. Thank you, and this is the end of Lesson 1.